It's fine.
The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone, and thank you so much for being here. My name is Mary Beth Testa, and I have the pleasure of being NAFCC's Federal Policy Consultant in Washington, D.C. Thank you all for joining us for Count Us In, the Child Care Law Matters to All Family Child Care. As we're diving in, I'd like to do a quick poll of our participants. Nicole, can you flash that up, please?
Okay, so the poll should be up. If it hasn't flashed in front of your screen, go ahead and check your little control panel on the side and make sure you go ahead and answer it there.
So the question is, do you enroll children whose families pay with child care assistance or a subsidy? And a few variations on yes or no. All right, so looks like a majority of our participants tonight do enroll children whose families pay with a subsidy. We've got a few who, used to but don't currently. Some because rates are too low, and others because families in their area, in your area, aren't eligible. Thank you all for participating in that. Tonight, we're going to talk about how the Child Care and Development Block Grant affects all of us. And I think my screen keeps changing. Nicole, do you see that happening?
Yeah, sorry, I think the poll thing messed with it, but now we're good.
Okay, awesome. Sorry about that, guys. So tonight we're going to talk about the Child Care and Development Block Grant Law. We're going to talk about you. We're going to talk about family child care and where we can go from here. The Child Care and Development Block Grant Law sets the stage for child care assistance in the states, and that crucial assistance for low-income families who are working or in training or in school to be able to afford child care, and if we're doing it right, to be able to afford the child care that they choose that meets their needs. And we know we have a long way to go there. But the Child Care and Development Block Grant Law is not only about the subsidy program, it's also about the resources states have to support providers, any provider, whether you enroll subsidy, and even strategies for those who don't. CCDBG sets the stage for licensing, and how well that goes and where that's hard is all about the resources that are available. And it's also about who is licensed and who is left out, and who then is included in some of our bigger thinking about quality and availability and the workforce, or who is left out. We'll talk about NAFCC's federal policy agenda. We'll talk about what's going on out there for families and for you, and then we'll dive into some pieces of the law. We're not going to spend a lot of time tonight talking about the details of how subsidy works in the states, or how the federal law intends for it to work. If folks would like a webinar on that, we'd be delighted to provide that. I think tonight we're going to focus on some of the bigger strategies about supporting the practice of family child care and the business of family child care in states and communities. So those strategies and resources of licensing departments and our approaches to boost the quality of care, and how states prioritize family child care or just leave you out, which unfortunately we do hear from you in so many states and communities. And then we'll wrap up with some ways you can shape this, because none of this is over. None of this is done. There are always questions to be asked and questions to answer, and advocacy to promote the power of family child care. which happens to be NAFCC's mission, to support and leverage a nationwide network of providers and partners in expanding and promoting the power of family child care. And that's my favorite part of it. We do that through standards and accreditation, through professional development, and through advocacy. NAFCC's federal policy agenda, which I hope you've all seen, and if you haven't, let us know and we can make sure to get you a copy. It's the actions we want Congress to take in this session, which is 2 years, 2017 and 2018. It's also a roadmap for our teamwork and our advocacy action. It's a way to shine a spotlight on family child care priorities. We wrote this with the membership. We wrote this for the membership. And as you look through it, you should see yourself in the different pieces and parts of it. And it's our way of spreading a word about the word about those priorities to the U.S. House and Senate, as well as the early childhood field nationally. Family child care has something to say, has a set of priorities, and here's what we want you to do. Our policy agenda and our mission are all about family child care being part of the solution. The policy agenda is a chance to promote the power of family child care, the work of early education and learning opportunities, and the drive for quality in child care, the role for infants and toddlers and preschoolers and school-age children, and the benefits of mixed ages being together in a setting, a solution for the needs of rural America, the needs of military families, the needs of families seeking care during non-traditional hours, and so much more. And it's also placing a spotlight on the importance of a diverse, respected, compensated, professional early childhood workforce. Count us in. What does that mean? We're using that every time we talk about the policy agenda. We're using it tonight. The policy agenda and count us in, it's an attitude. It's an attitude that says we are quality, families are counting on us, we are ready, and we are crucial. So you should include us in your strategies. You should include us in your approaches. You should include us while you're debating how to support quality, how to support the workforce, how to deliver services. Count us in. A quick summary of those federal priorities, and again, the audience of this is Congress. The things we would say specifically in states would vary, and the things we might say as local decisions are made would vary as well. But at the federal level, our recommendations are to invest in the Child Care and Development Block Grant, and tonight we'll talk more about why. Invest in Head Start and Early Head Start, strengthen the Child and Adult Care Food Program, improve the dependent care tax credit, and safeguard policies and investments that support the well-being of children, families, and the early childhood workforce. That's our way of taking a stand for child well-being. That's our way of taking a stand for families, and that's our way of taking a stand for your health and well-being as well. Everything we do is about building the supply of family child care. We think that if we're doing that and doing that right, we're meeting the needs of rural families, the needs of families seeking infant care, the needs of families seeking out of school time care, the families that are working non-traditional hours or ever-changing shifts. We believe that building the supply of high-quality family child care means cultural and linguistic competence, and that's so important for families and for that connection with families and young children. And it also means increasing parent choice among high-quality, affordable options for children, infants through school age. We're trying to build those opportunities right in our neighborhoods. All of this that we're doing, all of this promoting the power of family child care, spreading the word about family child care, spreading the word about the child care law, there's a lot of players involved in this. This is NAFCC and you, but also so many other players that care about the success of family child care, and the numbers of those people and organizations that care grows. NAFCC is there in purple. connecting to state administrators, connecting to other national organizations, and connecting to you directly, and also your state and local family child care associations. In turn, in the states, we're working on bridging and facilitating more relationships with state-based advocates and organizations, the traditional advocates, the people like me who work with policymakers in state capitals. It's our job to go to meetings. It's our job to represent you well. And those partners in the states can be tremendous allies when it comes to some of the shaping that we need to do ahead. So lots of players, lots of audiences. There isn't an arrow to Congress and the administration. That's sort of a big flash there, because we all have a role in contacting our representatives and our senators and the administration and the agencies. Let's talk a little bit about what's going on out there. And some of these numbers are maybe going to feel very personal, things you're experiencing or that your colleagues are experiencing. There are 1 million paid providers in home-based settings across the country, 1 million. Now, not all of them would call themselves family child care providers, and certainly the states don't call them all family child care providers. Some of them are paid, but not a part of the known system. They're the neighbors, they're the family members, they're the friends. Of those 1 million, about 118,000 are what the National Survey of Early Childhood Education calls listed. That means they're literally on a list. Your state knows who you are. It doesn't mean you're necessarily licensed, but there's this much smaller subset of the community that is family child care or would consider themselves family child care. What your state calls you and how your state acknowledges you is a different thing, and we'll talk some more about that too. That's over 3 million children in home-based child care, again, in this combination of we know who you are and we don't know who you are. We believe that we can do more to support those 3 million children in home-based child care today and for their school and life success. We also know that the supply of licensed family child care is down 15% since 2011, which was not that long ago. And we know that those numbers are dropping in staggering ways in some of your states especially. Meanwhile, only 10 states license all family child care providers. That leaves a huge population of family child care that is perhaps exempt from licensure. Maybe that's how your state has set up the rules, that they set a threshold. You don't have to get a license until you enroll 2 kids not related to you, 4 kids, 5 kids, 6 kids, more. That's a lot of kids in the home of a provider not being recognized by her state, not being valued as a professional by her state, and not included in a lot of the decision making about the quality of care and the availability of care. About 1.4 million children are receiving subsidy assistance. That sounds like a lot maybe, but it's actually a historic low. Only 15% of the eligible families for assistance even get it. Where is everyone else? What are they patching together? How confusing is that for a child? What relationship are they able to make with their caregiver? And how worried is mom and dad about getting to work the next day and supporting their family? We have disparities in service by race. Did you know that 24% of children in subsidy-funded care are in family child care? People should be paying attention. They're in your care. Meanwhile, the price of child care is high and families are struggling with that. That's a strong headline. That makes news when the price is more than college. We see that come around. Those of us that are or work with the provider community know why the prices are the prices. We know that you're struggling too. We do think that we would be well served to have families and providers on the same side of the table on this one. This is not a you versus them situation or an us versus them situation. This is about how are we going to solve this together, because we have a whole problem. Families are working low-wage jobs in non-traditional hours, and their childcare choices are deeply affected by this. Our childcare policies and our childcare operations are kind of based on a 9-to-5 economy, and across the income spectrum, that's not really what we have anymore. And we need to start making some adjustments to how subsidy works, to how licensing works, to how you're supported, and how on earth we recruit for all of this all comes into play. All of this, all of you come to this work, all of us come to this work because of child well-being and healthy child development. But when these other pieces and parts are broken, when family child care providers are shutting down, when moms don't have great choices, great options, or can't afford their great options, child well-being is very much at risk. Families are afraid, families are stressed, the children feel and know this, and those kids are counting on you. So the Child Care and Development Block Grant, it's about all of us. It's the entry point. That comment I made a moment ago about how only 10 states license all of you, this is not about so much the importance of a license, although it is very important right now. That's also about how many people are left out of our systems, of our thinking. The license is your entryway. CCDBG is what holds us back and what launches us forward. Across birth to 12 in CCDBG, because those subsidy dollars can go up through age 12, together we're navigating licensure, quality initiatives, accessibility and affordability, that's the subsidy piece, and not just who's eligible, but also how much providers are paid and where a family can take that subsidy as states put more restrictions on this in an effort to drive families and encourage families to choose quality. They're starting to put parameters around where they can take their subsidy in a state. Professional development and qualifications, a hot topic, and approaches to monitoring. Who is that inspector and what is his or her expertise and how often and with what supports? Federal investment is crucial, but so are the states, state legislation, state regulations, and state budgets too. Here are some highlights, and we're going to dive into more of these. CCDBG policies and funds are the foundation of family child care and the opportunities for family child care. CCDBG guides state-level decisions like these. Who is licensed? What are the training requirements? What's the training availability? What's the training content? How many of you have to drive a great distance to get to training? How many of you drive a great distance to get to training and find that it's really meant for people who work in centers? But you need the credit, and so you do it, but it doesn't meet your needs. That's CCDBG 2. What are the health and safety requirements, and do they reflect a home setting? Do they reflect perhaps a variety of home settings and not just one way? What's the experience, the expertise, and the caseload of the monitors and inspectors? And what supports are available? And does all of that make sense for the family child care setting and the providers themselves? We can thank CCDBG for that. More, where can that parent take her subsidy assistance? Is it to any provider in the community? Is it people only who are licensed? Is it people only at a certain star level? And how is family child care a part of that as we change those decisions? How is licensing status related to your participation in QRIS? Can you be exempt and still be considered part of a journey to quality? How is accreditation status related to participating in QRIS? Are those things linked? Is your effort rewarded, or do you have to do duplicate? Are parents who seek information getting referrals to family child care, or are they only getting referred to centers in the area? Are parents who pay with a subsidy getting referrals to family child care, or does it depend? Do the quality set-aside activities of the law, and we'll talk more about that, include family child care, and are they meaningful to family child care? And what about the programs and providers that the state decides to leave out of these questions? And what does that mean for the success of family child care? And also, what does that mean for families? The Child Care and Development Block Grant Law has 4 focus areas. 1, protect the health and safety of children in child care. I think we can all agree that that is wise. 2, help parents make informed consumer choices and access information to support child development. Great. 3, provide equal access to stable, high-quality child care for low-income children. 4, enhance the quality of child care and the early childhood workforce. The reauthorization of the child care law in 2014 put the child back in the center of this law. The reauthorization of 2014 has a lot of new and different ideas building on a lot of the creativity from the states going back 20 years past. All of those learnings, all of those attempts, but we have not funded that reauthorization. Congress passed the law, but the money moves on a different track. And so we've kind of eked along. And because we've starved the law, family child care has suffered and families have suffered. If we boost the funding for the law, we can boost families and we can boost family child care. Our principles and areas to shape state decisions as we think about the states implementing the law. 1, building the supply of high-quality family child care is crucial for families and communities. That's our starting place. Family child care needs a clear place in those consumer education efforts, those professional development efforts, and in quality initiatives. We've got to broaden our thinking there and focus on all settings. Family child care needs clear consideration in licensing content. What does it say? What do those regulations actually say? And does it make sense for home settings? And inspection strategies too. Family child care is the early childhood workforce. Accreditation is a commitment to continuous quality improvement. The details matter, and NAFCC members have day-to-day experience with implementation of policy. That's what makes NAFCC important. That's what makes you the best advocates. And federal and state investment is crucial for the successful implementation of the law. Nicole, can we put up the next poll, please? So the question on the table is, my state agencies and the support services in my community or state embrace the power of family child care? Yes, sometimes, and no. Getting a lot of sometimes. Anyone else want to chime in? Yes, sometimes, or no. You can use the tools in that little taskbar. All right, we're in with 63% sometimes my state embraces and prioritizes family child care. With 26% saying yes, they do. I'm pleased and impressed. And 11% coming in at no. All right, let's ask the next one real quick. I wish there was something we could do about that. It's sort of a trick question, isn't it? You all have to say yes just to humor me. Because there is something we can do about this. Terrific, everyone. Thank you. We got 100% yes. All right, we'll close that out and I'll put my screen back. Okay. So there's a couple places in particular where the law really sort of yells to me, hey, this is family child care. The lead agencies, those are your lead state agencies, are required in the law to develop and implement strategies to increase the supply and improve the quality of child care for children in underserved areas, for infants and toddlers, for children with disabilities, and those needing care in non-traditional hours. Sounds like you guys to me. It also requires state agencies to prioritize investments, small as they have been, but we're working on that. Prioritize investments that increase access to high-quality childcare for children in areas with significant concentrations of poverty and unemployment and a lack of high-quality childcare. There's a few different strategies that NAFCC has been out there promoting, but we would sure love to be doing that together and continue shaping these together. Strategies for building the supply, licensing entry. How do you get in? How hard is it to get in? Does your state even want you based on where its threshold is for how many children you have to have? Is there any kind of an orientation? Is there any kind of support? Or do they sort of hand you the regulatory documents and you're left to hope you can figure it out? Licensing standards, that those regulations themselves, what do they say? Are they doable? Are they smart? Are they sound? Are they keeping children safe? And can you implement them? Those monitoring approaches, who is that inspector and what is her expertise and how is she supporting you? Those training requirements, subsidy payment rates are definitely a deal breaker for so many providers. When those rates are too low, it undermines your operations, it undermines your business, and it undermines quality. We need to get those rates boosted. Coaching and mentoring are strategies that work. Those are personal relationships with somebody who knows about family child care and is a part of your journey. Family child care networks are where some of those coaching and mentoring services and more can all come together in a sustainable way. Infant and toddler specialist networks, those experts really working with us on care of babies and supporting families with babies. And of course, family child care associations. We can also talk at length about the opportunity and even the challenges of early Head Start childcare partnerships, of quality rating and improvement systems. We've got a long journey to go there to get those recognizing family childcare, but those are the tools states are using, and that's where we need to be saying, count us in a smart, meaningful way that still looks like home-based childcare. Accreditation, the childcare feed program, and even preschool and early learning initiatives. We're not going to talk about all of these things tonight. We're going to jump in on a few of them that really focus on this sort of these ideas that this is indeed about all of us. Let's talk about licensing, shall we? So new in the law is, so the law does not say that subsidy can only go in licensed child care. But some states have said this. Some states said this even before the reauthorization. States are increasingly looking at this now. What would that mean for family child care based on how your state draws the line of who is licensed and who is not? What would it mean for families? What's it going to mean for people previously not a part of the monitored system to newly be monitored, or are there supports there? Anyway, sorry. The new law does say that you have to have an annual inspection of the providers, whether they're licensed or license exempt, if they enroll subsidy. The regulation has an encouragement for states to inspect licensed providers, even if you don't enroll subsidy. This is a challenging one. What we don't want is states setting up two kinds of systems, one that's okay enough for families who are struggling and one that's okay enough for the private pay families. We need to be more thoughtful about these systems coming together and acknowledging you and acknowledging what families need access to. So that's challenging. Also challenging, though, is how are we going to implement all of these licensing regulations? And the conversations in the community are things like, how do we do a culture shift? How do we shift from this compliance-only checklist to licensing being a part of continuous quality improvement, a part of your journey, a part of your story arc for the quality conversation overall? What about collaborative monitoring? What about the many, many kinds of inspectors that are coming to your program for many different initiatives or funding streams or reasons? What would it look like for your state to take the opportunity and maybe kind of streamline? And maybe that would be more supportive to you if that monitor could be there for multiple reasons. And again, let's not split up the system, like I was saying before, and make even more equity challenges. Some action steps for states: create pathways to licensure. Make it possible to succeed at your licensing entry point. If we've got a new person to welcome to the profession, let's get her in. Let's get him or her in. The regulatory content needs to be appropriate and also strong for home-based settings. These are not centers. It has to reflect that it's a home kitchen, home bathrooms, home settings, and also reflect that it might be an apartment, or it might be a single family home, or it might be any number of other kinds of homes. Those monitors, what is their training? What is their content knowledge? Are they familiar with what they're looking at when they're looking at family child care? These are all things that are okay for our community to expect and to ask for. And also their caseloads. Are there enough staff so that their caseloads are such that they can actually spend time with you and not just do checklist, but actually do relationship with you? How do we leverage those other and existing systems and monitors, those other people that are coming to your home? And my goodness, please collect stakeholder input. Ask the community what ought to go on. And when they ask us, we need to answer. We need to do our part too. These are things that are about all of us, whether or not you enroll a subsidy family, or whether you completely enroll subsidy families, or whether you never will, because that's not your community. How a state approaches the content of their licensing rules and how they manage those entry points and those supports, that's about all of us. Are they prioritizing family child care? Are we an afterthought? Is it something in between? Let's talk for a minute about NAFCC accreditation. Accreditation opportunities have been managed by NAFCC for the family child care field for over 25 years. It's a commitment to continuous quality improvement, and it's based on relationships, and it works. The standards are research-based. They demonstrate principles of child growth and development and reflect best practices in the early childhood field. States should be leveraging this. And in the meantime, there are things they can do, start building on using the child care law. They should consider the pathway of training requirements and leverage accreditation for those quality improvement goals. States can use their quality set-aside dollars. There's a list. Every state has to use a certain amount of their federal money for quality activities. And that's about all of you too. That's about all family child care too. One of the things on that menu is support accreditation. 29 states currently use their federal dollars to support accreditation. Is one of them yours? And what does support mean? That can mean so many different things. This is also an opportunity for you to tell states that they ought to support NAFCC accreditation in particular, and what you'd need that support to mean. Do you need more awareness in your state? Do you need do you need providers to get some financial assistance to go on that accreditation journey? All of these things are possible, and many of you might be in a state that does that kind of investment in family child care providers. Some of you, we hear that support used to happen, but the funding dried up. let's get that funding back and let's make those choices again in the states. We'd also like to see links, and those crosswalks is the term that the systems people use, linking accreditation in QRIS so that we're leveraging the effort that you're making, so that you're rewarded for the effort that you're making. And I think that would also go a long way to informing QRIS standards about what works in home-based settings. Let's also talk about the training and professional development piece. We're building a pathway for the early childhood workforce. This is a hot topic right now. If we agree that not just anyone can do this work, although so many states allow just anyone to call themselves a family child care provider, if not just anyone can do this, what does it take? We need to keep working together to explain, what does it take? What prepared you for this work? What makes you competent to do this job? That competency word keeps coming up. What are your skills and how did you get them? So that children are not only safe, but having healthy child development and having those relationships with you and with the children around them, so that they are ready for a great day and also ready for school and for life. How did you know how to do that? That's the thing we need to explain. Meanwhile, training requirements that are in place and are in progress, the CCDBG law requires states to step up their game on the health and safety requirements of their regulations. And for people who enroll subsidy families, they will have to be trained on those topics. But it goes beyond that too. I think where the quality set aside comes in, and as states are thinking wholesale about what they're going to do with their training requirements, that's another place where it reaches into all of us, even if you don't enroll subsidy families or don't right now. Or how would you be prepared to do so in the future if they mistakenly create a bifurcated system in the state? Those linkages also go beyond licensing as we think about the license as the foundation, as the baseline. Licensing rules for all this time have been about minimums. What's the least we're gonna expect from people? It's growing from there and it's changing, but thinking about the profession, thinking about the early childhood workforce, we're thinking about quality. We're not talking about how little can we do anymore. We're talking about how important these jobs are, how important you are for the outcomes that we expect for young children, for their social emotional development, for their cognitive development, for their play, for their health, for their learning. Action steps for states here are to ensure that the content of required training is relevant to family child care settings. That should be a good thing to ask for. I encourage you to ask for that, and we can help. Connecting the goal of training to the overall quality and improvement of practice. We're not going to training just to go. Let's go because it's meaningful to our practice and we're supported to apply it in our practice. And then ensure the delivery of training is accessible to the work life of family child care providers. It's got to be near you. It's got to be at hours you can get there. It's got to be in the language that you need. And it certainly has to be affordable for you. Let's recap the many ways that this influences the availability of family child care and the many ways it influences you and your practice. Who is licensed? Do you count or are you left out? What are the training requirements, the training availability, and the training content? What are the health and safety requirements, and can you be successful? What's the experience, the expertise, and the caseload of those monitors and inspectors, and what supports are available? Where can families take their subsidy? Is it you or is it definitely not you? And that's a problem. How do we make sure that families are able to choose and then afford their choice? How does licensing status relate to participation in QRIS? How is accreditation figuring into all of this? When parents are getting information and referrals, are they getting pointed to their family child care options, or do the centers come up first on the list because of the way your state has set things up? And do those quality drivers, those quality set-aside investments, invest in you in a way that is meaningful to you? And what does it mean when we leave you out? So over the last few years, you've received many action alerts, calls to action from NAFCC and others, asking you to make a call to your member of Congress about investing in the Child Care and Development Block Grant. This is a battle we fight every single year on Capitol Hill. Some years it takes longer than others. We are still dealing with last year's mess. And like I said earlier, we've only eked along a little at a time. And while we appreciate that, we're starving the law, and so we're starving family child care, and child well-being is at stake here, and family well-being is at stake here. We took a huge turn in December when Senate leadership, when Democratic leadership in the Senate said, we are going to double the funding for the Child Care and Development Block Grant, and we are going to start that now. We're going to do a $2.9 billion increase in FY18 and a $2.9 billion increase in FY19. What a turnaround for all of these creative and also just some plain simple strategies that the states could do if we had given them resources. Investments in you if the states and communities had resources through the Child Care and Development Block Grant. So boy, were we excited, not only about that announcement, but flash forward to 2 weeks ago, no, a month ago, sorry, when Congress passed a bipartisan budget agreement that did many things. One of the things it did was extend their deadline again to March 23rd. But in extending it, it said, oh, and by the way, you're going to double funding for CCDBG and a couple of other things too. It also extended the Children's Health Insurance Program and the Early Childhood Home Visiting Program. That was signed into law. You will double CCDBG in FY18. Well, we have a bit of a challenge, and boy, do I need your help. And thank you to everyone who has already made calls. The deal was made and signed into law, but it did hinge on Congress finishing the FY 2018 process. And that process is stalling out. They're not fighting about the child care money, but if they stall out, we can't have the child care money, and that's a problem. And so the ask right now is finish your job, please, Congress. The ask right now is that we need you to finish and include that investment and finish by March 23rd. The little script is on your screen right now. I need you to please, if you haven't already, make 3 phone calls. And I know that your time is short and the phone calls in the daytime are very difficult. I will say that as soon as we adjourn this webinar, you could call right now and leave voicemails in their offices, in their DC offices. We're asking people to call their 2 US senators. They're organized by state, and you can look them up if you don't know their names and phone numbers. At www.senate.gov, and your 1 US representative whose phone number you can look up at www.house.gov. A staff person will answer the phone. A super friendly and polite person will write down what you say. And the more times they have to write this down, the more it's going to get noticed. We need the offices to feel the pressure of finish your job and include the child care increase. Again, you could call if you wanted as soon as we hang up, even though DC offices are mainly closed right now, and leave a message, or call first thing in the morning or anytime you're able tomorrow. But this is urgent. For those of you tuning into this recording at a future date, we're talking about this on March 8th, and time is running short. Please contact NAFCC if to check on the status of this. That was like a time traveler moment in our recorded webinar. So that's the action step that is immediate. In the weeks ahead, it just so happens that this is the year that states have to write what's called their CCDF state plan, their Child Care and Development Fund state plan. It is the description to great detail of how they're going to use their federal dollars. States have a template to use. Every state is going to answer the same questions. They will all answer them in their own way, but it's all about how they're complying with the law and how they're going to, and then where they have choices within the law, how they're investing those dollars. So our question for each state plan being prepared now, they are due to the federal agency this summer. Does the plan prioritize family child care? Do the plans include family child care at all? Does your state see family child care as part of the solution? Those are the overarching questions. We have specific things we'd sure love the states to try. And your perspective and your experience in the state goes much further than I can help you with. We want to marry all of that together and make sure that family child care is speaking and is heard in the state plan development. The states are required to have a public comment hearing, a public comment period. Even if you can't get to that hearing itself, there are still ways to weigh in, and we highly encourage you to do so. To make that as easy as possible to weigh in with some of these unified ideas for you to then tailor with your specific state circumstances and needs, NAFCC is developing a toolkit, and that will be coming out soon. Your action steps in this process are to connect with your state and local family child care association and me. I'd love to hear from you also. And connect with other interested advocates in your state. Again, there are many of the sort of, call them traditional advocates, who are going to be interested in weighing in on this state plan. Are they prepared to read the plan and see whether family child care is a priority, or see where that's missing and needs to be suggested? And then participate in that comment period, which again, the toolkit will help you to do. It will be written to be used in every state. You will then need to work on how to convey those messages in your state. The comment periods aren't all going to happen at the same time. The drafts in the states aren't all going to be released at the same time. As we hear things, we'll put that out there. But again, this is also where tuning into your state agencies, tuning into your associations, and tuning into other interested advocates are going to help you find out. You couldn't possibly, as you're running your business, as you're running your program, keep track of every single newsflash document, but that's what you can rely on some of the rest of us for. We want to help each other as best we can. This is the state plan for the next 3 years. This is your state's chance to really put it out there. Family child care is a priority in our state. Family child care is a part of the solution in our state. And here's how we're going to support them so that they can support families. That's what we should be asking for in the state plans. At NAFCC, we say, count us in. We have so many challenges. You have so many challenges. You are pushed and pulled and shoved and left out of so many conversations, of so many policy choices. We're here to try to change that. We're here to try to say this count us in attitude, this we belong here attitude. Here are the ways to include us. And it's going to take some different thinking. One of the things I often say is that we're trying to change hearts and minds and policy in the states and at the national level. But we need to stick together to do that. When it's challenging, we can shape it. I believe that if we stick together as a team. With that, I want to see if we got questions, anything I can answer tonight for you. You can type a question into the question box, or you can send an email to policy@nafcc.org, and I will get back to you with an answer, or find someone who knows the answer. We got a question from Ingrid, QRIS. I apologize for using jargon. I should not have done that, and I'm sorry. Quality Rating and Improvement System. And some states give them different names. ABC Quality, Virginia Quality, Step Up to Quality, Come Dance with Quality. The states call them different things, but Quality Rating and Improvement System is the name for these tools that states use to indicate, hey, based on this list of standards, we rank you here, we rank you there, you can achieve this other ranking too. And it's supposed to come with some supports. It's supposed to come with supportive coaches and monitors who know what you're going through and know what your journey of quality is. It's also best if it comes with some financial backing to meet these higher levels, to rise above and build on the foundation of licensure, but it doesn't always, and that's a problem. And one of the things we also see in the states is that they were designed for centers, and you can't just wiggle in a family child care home into something designed for centers. And gosh, we could be more thoughtful about those standards. And maybe the question or the reason that hasn't been done is a resource, a money question. Maybe it hasn't been done because we have to change some hearts and minds and also change the policies in those states. Thank you. Yes, Kathy notes that it's called Quality Stars in New York. Do we have any other questions tonight? Nicole, do you see any others? I don't see any others.
We just had one pop.
Oh, I just saw that. The Maryland question. Hey, Linda Church, are you still on? I think you're still on the line too. We got a question from a Marylander where they are talking again about expansion of pre-K. There's a great conversation going on in Maryland, Lynette, in the family child care community and alliances with others. May I highly, oh good, Jacqueline Grant is here too. Lynette, may I highly recommend that you get in touch with the Maryland Family Child Care Association and be a part of that conversation. Lynette, could you send another, Lynette Arana, if you don't mind, send another question bubble with how to contact you? And I can help connect you to the Maryland Association. Oh, great. You're connecting right now. I love that. All right. Any other questions tonight, or we will adjourn? This webinar has been recorded in case you wanted to tune into anything or share this with colleagues who couldn't be here tonight. And we're always available at policy@nafcc.org for your questions and connection building and idea sharing. We really appreciate your teamwork. We really appreciate our ability to work together to promote the power of family child care. Thank you, everyone.